All right, greetings from South Dakota. My presentation is going to be much more of a thought map, just kind of the way my brain thinks about some of these things rather than some hard data like we've seen. But I would say that examples of what's been presented before me, I think are just really inspiring, the types of questions that are being answered and the fact that there's all these resources available and teams set up and processes in place to do some of this stuff. So this is a timely topic for me. Just a couple of weeks ago, we had one of the things we do in South Dakota is have what we call One Health seminars. And Kristen, I think you brought up the fact that it's nice to have veterinarians and animal producers kind of, maybe walk through a hospital and see how they do things in their worlds. And that's what we try to do with these seminars. And we just had one 2 weeks ago that dealt with antibiotic use in animals and people. So the program was split 50-50 between veterinarians talking about how they use antibiotics and their stewardship, and human health professionals, whether they're in hospital settings or community settings, talking about those things. And so it's just really great way to kind of get some conversations going. So that just happened and went very well. The thing that I really like about those sessions is I do the evaluations, and it's about 50-50 split between animal interest people and human health interest people. So here's South Dakota. As you can see graphically there, we have a lot more animals than people. I don't mind it that way. I kind of like it. The cattle industry is growing actually in South Dakota. The beef cattle numbers are pretty steady, but we have more and more dairy cattle all the time, and the swine industries are growing as well too. And our human population kind of stays the same. So with that backdrop, we do have a lot of animals, a lot of animal agriculture in our state, a lot of other things in our state. One of the, two of the things we have are high rates of these enteric diseases. So with our animals, the presumption here is that because we have a lot of farm agricultural exposures, maybe that our rates of things like S-tech and salmonella, I could add crypto and Campylobacter probably in there too. We have very high rates relative to the rest of the country of these enteric diseases. So knowing that, we did work, and thanks to all of you for funding our project, kind of like what Carrie was talking about. We wanted to look into, for this example, it was cryptosporidiosis and S-tech in our South Dakota populations, and then go back and interview those people who were infected and see what their animals' exposures were. And you see that for both of those, living and working on a farm were significant exposures. We don't have, this was kind of a special project for us. We don't have a diarrhea team in South Dakota. We have like a diarrhea person. So it's a lot more work, but we did kind of buckle down on this project to go into some of that detail that Carrie was mentioning. And thanks to funding from UMass on a project way back then, we were able to set some of these things in motion. So here, this is just another graphical depiction. I'm sure a lot of people in this room have seen this graphic from CDC. And John put up a graphic too that just kind of illustrates how complex antimicrobial resistance is. But the crux of it is the use of antibiotics, whether you're talking about in animals or in people, will result in the rise of antimicrobial resistance in those bacteria that are exposed to that antibiotic. And so some of this is on the human side of things, and some of this is on the animal side, and we have this intersection in the middle. So if I want to break this down here and look at how my mind kind of thinks about these issues of antibiotic use in animals and their effect on people, and if we specifically think about farm workers here, we do have this potential for antibiotic-resistant bacteria to transfer from animals to workers during the course of their work. But we also have to realize that There's the antibiotic susceptible germs that are transferred to workers at the same time. So whether, it really doesn't matter whether those germs are resistant or susceptible. So a lot of what our educational efforts in extension and public health in South Dakota are like they are here in Minnesota and elsewhere, is how do we kind of look at that connection between the workers and the animals and promote good personal protective equipment use, hand hygiene, those kind of things. So that's the one kind of thought process going on here too. But I also think we ought to think about the applications of antibiotics to the human population that's not necessarily connected with agriculture. We have antibiotics being prescribed to human populations in hospitals and community settings, and antibiotic resistance arises in those populations as well. So what is the possibility of a worker actually taking one of the antibiotic-resistant organisms that's in their system and transferring back to animals? That's something that is worth thinking about. It would be kind of a stretch to think of some of these enteric germs passing from people back to animals, but when you talk about Staph aureus or tuberculosis even, we do have some documented cases where we feel pretty strongly that human workers have transmitted tuberculosis to cattle populations. So that's another kind of twist on things that I think about when we're looking at this whole antibiotic resistance issue in people and animals, and what's the implication for animal populations as well. So most of my work, I wear, like Jeff mentioned, I wear a lot of hats, not the governor's hat, thank goodness, but I do wear a lot of hats in South Dakota, but my main appointment is as extension veterinarian. So I deal a lot with animal agriculture in our state. And so for the last part of this, I just wanted to think about how that is changing, animal agriculture is changing, at least from my viewpoint in South Dakota. I think a lot of these things would apply to you anywhere here in the upper Midwest as well. We don't raise animals the way we did 50 years ago, or even 20 years ago, or even 10 years ago with some of these things. And so my thoughts, and this is more for discussion than any hard data, that's for sure, but I want us to think about some things here. So to me, it's either looking at how do we change antibiotic use in animals, or how do we modify that contact between animals and people on the farm. And so what's the role of certain technologies? What's the role of changes in animal agriculture where these arise? So the first thing I want to throw out there is the onset of robotic milkers. So here's a situation where the robotic milkers are set up in dairy farms, and the cows just kind of, I'm grossly oversimplifying this, but the cows just kind of walk in and get milk themselves. No humans are involved in the process here. The robot cleans the teats, attaches the cups, monitors the milk flow, detaches the cups. The cow walks away, and there's no human involved here. Contrasting that with the traditional way of milking, where the worker is there putting on the cups, getting the tail swished in the face full of manure, and those kind of things. So how does that kind of technology change animal contact? Well, it changes it a great deal because you're not having as much human contact with the animals directly. Then I thought, well, how does that change antibiotic use? And I'm not sure how that correlates. You know, when we have robotic milkers, those systems flag cows with mastitis, and they flag animals that need antibiotic treatment. A lot of that kind of same thing is done in the traditional milk flow meters as well, but you do have humans here monitoring those animals for potential need to be treated with antibiotics. Now, are the humans better or are the machines better? That's an argument we can have, but it does affect how antibiotics would get used on a particular farm. Staying on the dairy, on the calf side of things, we have many farms that are going away from the traditional feeding of the baby calves, so the calves that are from 0 to 6 weeks old. We have people going away from physically handling that animal every day and giving them a bottle 2 or 3 times a day versus the self-service milk replacer dispenser that calves just kind of go up to and feed on their own. So here again, a lot less worker contact with each individual animal, and the machine here will do a job of diagnosing sickness and flagging animals for antibiotic treatment because the machine knows when a calf hasn't gotten up to drink. And versus the human side of things where we have to visually diagnose sick calves. One aspect of antibiotic use that's an offshoot of automatic calf feeders is that these animals have to be kept in group housing in a building, and that oftentimes means more instances of respiratory disease in the calves, more instances of enteric diseases in the calves. And unless they're managed very well, it could actually mean a decrease in worker contact, but an increase in antibiotic use in some cases. So beef cattle is our main animal agriculture enterprise in South Dakota for sure. What's happened as I've worked with cattle producers over the last, since I got out of vet school a long time ago now, what we've been seeing now, the technological advances in beef cattle, and you think about technology and cow-calf herds, that doesn't really go together, but in ways there are some changes. And what we see in our climate anyway is the onset of confinement housing for even beef cow herds. So in other words, we're seeing hoop barns being built to shelter animals from the harsh spring. It allows animals to be inside. It allows animals to be easier to access and treat a sick animal, which is a good thing for animal welfare, but it might mean more contact with animals compared to trying to find a sick calf out on the back 40, 1,000-acre pasture, and trying to catch that calf and give it a treatment. Now, compared with the wide open spaces, animals are in much closer contact again, kind of like the example with the robotic milking. So animals might have more of a chance of lung infections, enteric diseases, rather than being spread out. And what this does, actually, it makes these producers a little more apt to manage their environment, keep things cleaner. So generally, we would think that antibiotic use would probably be higher in situations like this compared to this. But if it's like a spring like we just had in South Dakota, it might not be that 1,000-acre grassy pasture. It might be this mucky mess. So it doesn't necessarily mean that the wide open spaces are going to be better for pathogen load for calves. So another example of how how these advances, how these changes will affect how often we can get in touch, can touch animals and contact them. And manure management, that becomes a whole other issue as well. Now here's something that came out after I kind of got out of practice and went to the academic world. We have a lot of beef cattle producers using dart guns to treat sick animals with antibiotics. And the rationale here is that I have a calf with pink eye out on the pasture. She's 2 miles away from any sort of handling facility. Otherwise, I've got to rope this calf and hornswoggle it and get a shot into it and really fight with that calf. Or I could just take this dart gun out and stand here over across the room and fire a shot of antibiotic into the neck of that animal and treat it that way. So that's something that is actually not uncommon at all in our beef cattle operations. And you're usually talking about the pasture situation. So think about contact with cattle. If I'm shooting from across the room, I don't have any contact with the cattle directly, right? The trouble or the interesting thing about the use of dart guns and antibiotics is that the darts are only so big. And in order to get a low enough or a potent, I'm going to say this wrong, but the dosages of something like penicillin, if I was going to treat a cow with penicillin, I'd need 50 cc's of antibiotic. I'd need 50 cc's of penicillin. And you don't make darts that big, right? So I'm going to have to go to Draxxin or a macrolide antibiotic, maybe even a fluoroquinolone, which is a lower dose that I can fit in that dart. So my choice of not being in contact with that animal means I'm going to change my antibiotic choice, which is usually a higher order antibiotic for human medical use. Might mean that we can treat animals more often, but so there's a trade-off with contact and antibiotic use there. With feedlot cattle, we have a situation where we will oftentimes get in bunches of sick cattle, or not sick cattle, but what we call high-risk cattle. Cattle that have been transported a long way, maybe they've just been weaned. We know that some of those animals are already starting to show clinical signs of illness, and we know that others the next day or the day after that are going to get sick. So it's not uncommon for producers to use what's called metaphylaxis and giving a whole injection, a full dose of an injection of antibiotics to the feedlot animals as they come into the feed yard. It is a wonderful practice for animal welfare. It is a wonderful practice for reducing death loss and reducing sickness for these groups of high-risk animals. But right now, our technology really is such that we don't know of that bunch of calves, which of those calves really needs that shot, because not all of them would need that. We don't have, so right now we just blanket treat everybody. So there are some technologies coming. They're not where we need it to be yet. Things like what we call a whisper stethoscope. You put the stethoscope up to the calf. It records the lung sounds and plugs that into an algorithm saying, hey, this calf is somebody we better pay attention to. Maybe this is the one we should give an antibiotic to rather than one that would check out normal. There's also some being developed in the chute-side tests to take little blood samples from animals and measure things like eosinophil counts or acute phase proteins in animals that are coming there, and hopefully using that information to gauge whether antibiotics should be used or not. So these have the potential to really reduce antibiotic use, but all of these are pretty invasive technologies when you're talking about contact with animals. You're putting your stethoscope up to the chest, or you're jerking the tail up to get a blood sample. So again, what affects contact might be something that potentially decreases the antibiotic use. So in conclusion, oftentimes we want to kind of harken back to the way we used to raise animals, but in fact, a lot of the things we did to raise animals way back when meant a lot of animal contact. And if we're talking about exposure of workers to all enteric germs and other germs, whether they're antibiotic resistant or not, that's going to mean more chances for human infection. So technology is always advancing in animal agriculture, and so I think it's interesting. Like you probably gathered from this, I don't have any of the answers here, but I did want to throw out some of these things as discussion points of what's the future look like for animal agriculture, and how does that affect what we're talking about here. And I can say with pretty good conviction that the future of animal agriculture is going to mean less human labor, as you see from some of these demonstrations. It's hard enough to get the dairy workers to come work. So that's why people are thinking about robotic milking and some of these other technologies. So with that, thank you very much for having me, and I'll turn it back over to our moderator.